Hey, iPrevent fam. July 28th is World Hepatitis Day. This date honors the birthday of Nobel laureate Professor Baruch Samuel Blumberg, discoverer of the hepatitis B virus. In observance, we're going to take you through the various forms of viral hepatitis, the causes, prevention, and treatment. So what is hepatitis exactly? Hepatitis is a general term for inflammation of the liver. Inflammation is swelling that happens when tissues of the body are injured or infected. This swelling and damage can affect how well your liver functions. There are 5 distinct types of viral hepatitis known as A, B, C, D, and E. Each can cause acute or chronic infection and trigger inflammation in the liver. There are also forms of non-viral hepatitis known as alcoholic hepatitis and autoimmune hepatitis. Now let's break down the causes of the different types of viral hepatitis according to mayoclinic.org. You're most likely to get hepatitis A from contaminated food or water or from close contact with a person or object that's infected. Mild cases of hepatitis A don't require treatment. Most people who are infected recover completely with no permanent liver damage. Hepatitis B infection is caused by the hepatitis B virus or HBV. The virus is passed from person to person through blood, semen, or other bodily fluids. It does not spread by sneezing or coughing. Hepatitis C infection is caused by the hepatitis C virus or HCV. The infection spreads when blood containing the virus enters the bloodstream of a person who is not infected. Hepatitis D virus or HDV is a virus that requires the hepatitis B virus HBV for its replication. HDV infection occurs when people become infected with both hepatitis B and D simultaneously or get hepatitis D after first being infected with hepatitis B. Hepatitis E is an inflammation of the liver caused by an infection with the hepatitis E virus or HEV. The virus is transmitted via the fecal-oral route, principally via contaminated water. To sum things up, viral hepatitis A and E are caused by consuming contaminated food and water, while viral hepatitis B, C, and D are primarily caused by coming into parenteral contact with bodily fluids. Alcoholic hepatitis is an example of non-viral hepatitis. This often occurs in people who drink heavily over many years. But the link between drinking and alcoholic hepatitis isn't simple. Not all heavy drinkers get alcoholic hepatitis, and some people who drink much less get the disease. Autoimmune hepatitis causes chronic inflammation in your liver, the same way other types of hepatitis do. But instead of a virus or alcohol damaging your liver, it's your own immune system attacking it. Experts don't know what causes it, but it is more likely to appear in people living with other autoimmune conditions. Let's talk about prevention. It is essential to raise awareness about the different types of hepatitis viruses and to promote proactive health measures to safeguard liver health. The best way to protect yourself and your sexual partners is to wear a condom. Condoms act as a barrier between skin-on-skin contact and the exchange of bodily fluids. If you need condoms, you can call us at 504-418-4955 and come to our office at 1125 North Tonti Street. Did you know that there are vaccines to help prevent hepatitis A and B? The hepatitis A vaccine is an inactivated virus vaccine. The hepatitis B vaccine is usually given as 2, 3, or 4 shots. Infants should get their first dose of hepatitis B vaccine at birth and will usually complete the series at 6 to 18 months of age. The birth dose of hepatitis B vaccine is an important part of preventing long-term illness in infants and the spread of hepatitis B. Anyone 59 years of age or younger who has not gotten the vaccine should be vaccinated. Hepatitis B vaccination is recommended for adults 60 years or older who are at an increased risk of exposure to hepatitis B who were not vaccinated previously. Adults 60 years or older who are not at an increased risk and were not vaccinated in the past may also be vaccinated. Hepatitis B, C, and D viruses are particularly concerning as they progress to chronic hepatitis. Chronic hepatitis can silently damage the liver over time, increasing the risk of developing cirrhosis, a condition where scar tissue replaces healthy liver tissue. Cirrhosis can ultimately lead to liver failure if left untreated. Moreover, individuals with chronic hepatitis B or C have a higher likelihood of developing liver cancer, emphasizing the importance of early detection and treatment. Hepatitis C is primarily contracted through blood-to-blood contact, often seen in intravenous drug users or through unsafe medical procedures. Practicing safe sex, avoiding sharing needles, and regular screenings for hepatitis C can significantly reduce the risk of infection and its long term consequences. Now let's talk about testing. Most forms of hepatitis are diagnosed by simple blood tests. In some cases, providers will do a liver ultrasound or a liver biopsy to determine the extent of any liver damage. In the case of hepatitis C, a viral load check will be done to measure the quantity of the hepatitis C virus in the blood. We recommend that everyone should get tested at least once per year, regardless of behaviors. As with all illness, early detection can save your life. If you feel as though you may have been exposed to hepatitis B, contact your healthcare provider immediately. A preventative treatment may reduce your risk of infection if you receive the treatment within 24 hours of exposure to the virus. Rapid tests check for the presence of antibodies in the blood. If you have ever tested positive for viral hepatitis, rapid tests will always read positive. Now let's talk about treatment. There is no cure for viral hepatitis. Hepatitis A generally goes away on its own with rest and comfort. Acute hepatitis B usually goes away by itself in 4 to 8 weeks. More than 9 out of 10 adults who get hepatitis B totally recover. However, about 1 in 20 people who get hepatitis B as adults become carriers, which means they have a chronic and long-lasting hepatitis B infection. Most people diagnosed with chronic hepatitis B infection need treatments for the rest of their lives. Hepatitis C can be treated with antiviral medication. Antivirals are used to clear the virus from the body. Talk with your provider about what type of hepatitis treatment may be right for you. It is important to be aware that if you have ever contracted the virus, you are more susceptible to becoming reinfected. Pegylated interferon alpha is generally recommended for treatment for hepatitis D virus infection. Treatment should last for at least 48 weeks, irrespective of the patient's response. It is important to discuss the risk for this treatment with your doctor. Hepatitis E usually resolves on its own within 4 to 6 weeks without specific treatment. However, supportive care can help manage symptoms and improve outcomes. This includes rest, hydration, nutrition, avoiding alcohol, and avoiding medications that can harm the liver, such as acetaminophen or paracetamol. Treatment for alcoholic hepatitis involves hydration, nutritional care, and stopping alcohol use. Steroid drugs can help reduce liver inflammation. Autoimmune hepatitis has no cure, but you can manage it with medication. You may even go into remission. So let's talk about symptoms. Hepatitis symptoms can vary depending on the type of hepatitis and can range from mild to severe. Some people with hepatitis may not experience any symptoms at all. That is why we call it the asymptomatic. Symptoms that do occur can include abdominal discomfort, which is pain or bloating in the upper right side of the abdomen, especially over the liver. Jaundice, which is yellowing of the skin or eyes. Dark urine, a buildup bilirubin in the blood and urine can cause urine to turn brown. Pale or clay-colored stools. Fatigue can be intermittent or constant, mild or debilitating. Low-grade fever, itching, loss of appetite, nausea and vomiting, weight loss, joint pain, which can be temporary and resolve when the immune system clears the virus. That was a lot to take in, I know, but we are here to help. Did you know that Odyssey House, Louisiana has 2 federally qualified health centers open to the community? Our clinics are located at 2700 South Broad and 1125 North Tonti. Our clinic offers hepatitis screening and treatment. Call us today at 504-383-8559 to make an appointment with one of our healthcare providers. Don't forget to give us a call at 504-418-4955 if you need safe sex materials such as condoms, lube, and dental dams. We also have harm reduction materials, Narcan, fentanyl test strips, and sterile syringes. We are in the office Monday through Friday from 8:30 a.m. to 4:30 p.m. Thank you for tuning in, and be sure to follow us across all the social media platforms at iPrevent_OHL. Until next time, fans.